Welcome everybody to today's debate hosted by SciDev-Net, which is the world's leading source of reliable and authoritative news, views and analysis about science and technology for global development. My name is Fiona Broom and I'm the Global Features and Podcasts Editor at SciDev-Net, and I will be moderating today. First of all, thank you for taking the time to join us. It's a busy time of year for a lot of you, and thanks especially to our panelists for finding space in their schedules to discuss this really important topic today. So COVID-19 vaccine distribution plans are being drawn up worldwide. And while SciDev-Net and other media outlets have reported over the past week or two that developing countries may be, unfortunately, facing a longer wait for COVID vaccines than was hoped, we still thought it was important to have this conversation now as preparations are beginning. Immunization campaigns face unique challenges in the global south, and the coronavirus pandemic has come at a unique time in history when more people around the world are connected to each other than ever before. But with so many sources of content, the world is experiencing what's being called an infodemic, which is an overabundance of information during an epidemic. Some of this information may be accurate and some of it may be inaccurate or deliberately misleading. And this deluge of information makes it difficult for the public to find reliable sources and guidance, and it makes it difficult for scientists and policymakers to combat bad information. SciDev-Net has been reporting on the impact that this infodemic is having on global coronavirus management strategies, including studies that have tried to measure whether vaccine confidence is taking a hit. The majority of this data is coming from the United States and Europe, with some surveys reporting that the number of people who say they would accept a COVID-19 vaccine is as low as 30% in certain regions. So today we want to discuss what the situation looks like in the global south and what techniques, programs and campaigns could be put into action to effectively communicate vaccine science to different communities around the world. On the panel today, we have Zaichen Malis Liu, who's the Strategic Programs Manager in Public Engagement at Wellcome, which is the research charity based in London. We also have Alison Weir. Alison is a research assistant at the University of Washington's START Center, and she's a member of Women in Global Health, which is a gender equality in health leadership campaign group. And we have Natalia Pasternak, who is president of Brazil's Science Question Institute. I'll leave you to pronounce the Portuguese name. And Natalia is a member of Team Halo, which is a project that was established in partnership with the Vaccine Confidence Project and collaborates with Gavi, the Vaccine Alliance, and UN Verified. We had hoped that David Heyman could join us today. He's Professor of Infectious Disease Epidemiology at the London School of Hygiene and Tropical Medicine. He's also head of the Chatham House Centre on Global Health Security. Unfortunately, he had a schedule clash. However, David was kind enough to record a few comments to open our conversation today. David worked with the World Health Organization for 22 years on communicable diseases, and prior to that, he worked in Cameroon, Cote d'Ivoire, the Democratic Republic of Congo, Malawi, and India on a range of infectious diseases, including Ebola, smallpox, and tuberculosis. So he has a wealth of experience, which will kick off our discussion. If you'll just bear with me for one moment as I prepare the video.
Well, you know, there's been mistrust in vaccinations since vaccinations were developed, actually. For the smallpox vaccination, for example, there were many anti-vaxxers already in the 19th century who were telling people not to get vaccinated against smallpox. As a result, people didn't trust vaccinators, and there were people who refused to get vaccinated, which could have prevented smallpox had they been vaccinated. That's carried through into the 20th century. And I can remember when I was at WHO back in the 1990s, there was a journalist actually who wrote a book stating that the polio vaccines, which had been developed in monkey kidney cells, actually were what introduced HIV into Africa, because some of the monkeys that were used to develop that vaccine were infected with a virus similar to HIV, and that virus then infected humans who were vaccinated with the vaccine in trials of the vaccine in Congo, in DRC Congo. So that rumor continued on the internet. And in addition, there were other rumors that developed around that. And by 2003, in the polio eradication program, there were rumors not only that polio vaccine could produce HIV in humans, but also that this vaccine was a Western plot to sterilize young girls because it had in it a chemical which caused chemical sterility of young girls, and that this was being targeted at Muslim girls. This rumor completely derailed vaccination programs for polio in the polio eradication program in northern Nigeria. And as a result, after 6 months, Nigeria had more polio than any other country in the world. But in addition, through Muslim trade routes and Islamic pilgrimage routes, the virus went to 18 countries that were polio free and all the way into Saudi Arabia, from Saudi Arabia into Indonesia. So trust in vaccinations is very important. And if there isn't trust, it can derail programs and cause very serious damage to human life, but also cause a great effort necessary to put things back on target. And in fact, the solution to this was a very long solution, which involved religious leaders, which involved political leaders in the Islamic community, which involved a whole series of activities, which took 1.5 years to get this back on rail. And finally, Nigeria was able to get rid of polio. Mistrust in COVID vaccinations will come from a group of anti-vaxxers who are just against any immunization whatsoever. They can't be deflected from this belief. This is a belief that they have, and it's not a rational belief, but it's one from which they can't be deflected. There is a whole group of people who are around them, who are being influenced by them, who can be converted to trust in a vaccine. And that's very difficult to do, especially when this is a new vaccine. And clearly there will be incidents that occur in relation to the time at which the vaccines were given, which have nothing to do with the vaccine. So for example, if an elderly person is vaccinated and 10 days later, that person dies from a comorbidity that they've had right along, it may be linked to the vaccine in the minds of many people and cause a decrease in trust in vaccinations. So a solution to this is transparency all along the way. Weekly reports by vaccination teams of what they're seeing as side effects, of what they're seeing that's expected from this vaccine, and the benefits of the vaccine as well, that it's preventing people, it's decreasing admissions to hospital, a whole series of positive messages. And in addition, a clear explanation when there is a death or there is a serious reaction that occurs that isn't related to vaccination, but is related in time to that vaccine, explaining to the population how this has happened and that these events go on regularly in a population that's vaccinated as well as a population that isn't vaccinated. Well, it's just good practice. When there is an event that occurs in the same time period as a vaccination, what must happen is that must be investigated to be sure it's not related to the vaccine in any way. And so they've done the right thing. They've done what's required by the data safety and monitoring boards. They've stopped vaccination until they had a chance to analyze the data with a group of experts to decide whether or not it might have been related to the vaccine. So that's something that's very important to do. It's also important after vaccination begins to let the population know that there may be rare side events from the vaccine that could occur as more populations are brought into a surveillance activity, because these events wouldn't be discovered in just the trials that were done. Those trials have shown that there's no immediate side effect that's dangerous to human health. But in the long term, there may be events that are identified, which are very rare, but if they are identified, the population should be told about them and should be told that these are rare events and that they can't really, and once a rare event is identified, if it is identified, there must be a risk-benefit analysis of the vaccine to show whether or not the risk of that rare event should, in fact, stop vaccinations, or is something that's acceptable because the risk is much less than the risk of getting COVID, for example.
So thanks again to David Heyman for providing that background detail, and that really offers some context to today's discussion. So let's jump on in. Zai-Chen, the Wellcome Global Monitor last year published a study of public attitudes to science and health on a global scale, with a focus on vaccine hesitancy, which the WHO last year named one of the top 10 threats to global health. What are some of the factors that contribute to vaccine hesitancy, and why is it important that COVID immunization programs are successful? And what does success actually look like?
Yeah, thanks, Fiona, and thanks to David again for the really helpful context comments, some really pertinent points for us to all bear in mind. So yes, these are super important questions and considerations. So I think first of all, touching on vaccine hesitancy, this is something that we've been working on and building our understanding of since the Global Monitor work. And firstly, it's important to recognize that vaccine hesitancy is really broad as a concept, as a topic, and covers a whole range of different factors which affect vaccination behavior and decision making. And these are varied and these are complex. And when the WHO last year declared vaccine hesitancy as a top health threat, it was in recognition of the spectrum that covers. So it's a really mixed, heterogeneous spectrum, including those people who delay, as well as those who refuse, as well as those who accept some but delay others, and for all sorts of different reasons and combinations. Going into a little bit more, the factors are very context dependent, and they do vary a lot between regions, countries, communities. And some of these may be more sustained and others may be more susceptible to change and are volatile and impacted by events that occur, some of the examples that David highlighted. In our understanding of this, we've been following a social and behaviorally informed model that the WHO, along with others in the demand hub of partners, UNICEF, Gavi, the Vaccine Alliance, and others, that they've been using. And it's called the increasing vaccination model. And that breaks down factors into practical, social, and personal. And this is really helpful as a way of understanding more about the complexities and about how they relate to each other. So on the practical side, things like cost, availability, ease of access are incredibly important. And globally, these are still the biggest barriers for vaccination. On the social side, there are things around social networks, social norms, and influences that can build or erode confidence and trust. And at a personal level, there's knowledge, there's risk appraisals, there's individual beliefs about particular vaccines, about vaccines in general. And altogether, these relate to service provision as well, and they relate to the wider ecosystem. So there's a lot of there's a lot all coming together, and they influence each other, interact, and there are all sorts of feedback loops and things. So we know that good service experience, good accessibility feeds into confidence and motivation, and we know that that can spread through social influences. trust is a hugely important topic within this, and again, so David highlighted some of the issues when trust isn't there. It's foundational in the context of immunization because there is vulnerability. People are vulnerable. They're making choices where there are uncertainties and where there are other priorities and concerns and considerations. And in the face of that, trust and trustworthiness must be in place. So
what does it mean for an immunization program to be successful? How do we measure success?
Yeah, so I think in the context of COVID-19 and immunization here, firstly, the disruption has been immense. The disruption caused by COVID-19. A statistic from UNICEF recently showed that 94 million children are at risk of missing measles vaccines because of paused campaigns in 26 countries. COVID is highlighting the gaps in health systems, and the impact is greatest on those people who are most vulnerable and those communities. So success is overcoming that. Success means a world in which the most vulnerable are protected. And it's one where immunization programs in general are also stronger and more responsive and more resilient. So the impact of COVID-19 efforts feeds back into those routine immunizations. And I think it's also important to say that success for this comes from an approach that isn't at all costs. We know from previous experiences with polio, with Ebola, that the community priorities, that their concerns that must be taken into account, they must be listened to, and they must be brought into the considerations. So success is also an approach that really responds to those needs from communities.
Yeah, great, thank you. Alison, you wrote a paper that was published in 2018. It was titled Vaccine Hesitancy Outbreaks, using epidemiological modeling of the spread of ideas to understand the effects of vaccine-related events on vaccine hesitancy. Could you tell us about your findings and how they relate to the current COVID context?
Sure, Fiona, thank you so much for this question. So just to provide a bit of context, I'm originally from Cameroon. I'm a Cameroon-trained physician, and I'm currently doing graduate studies in epidemiology at the University of Washington here in the United States. And I've been very lucky to experience vaccine hesitancy from different angles. Initially as a clinician in training, then as a clinician. And from a programmatic level, I've been involved in some of the biannual maternal and child health immunization programs that are organized within the country. And I've also been able to experience it as a researcher. So following my training as a clinician in Cameroon, I spent some time in South Africa, Cape Town, at the Cochrane Center at the South African Medical Research Council, where I had a chance to work with the vaccine research group there, looking at some of the issues around vaccine implementation. And now I'm, like I said, I'm currently doing graduate studies in epidemiology. And this article was actually born out of the fact that, you know, we were reading articles that were coming up in the news around vaccine hesitancy. And what we were observing is each time that there was an incident that didn't favor immunization programs very well, the reaction from the populations within that country and even within surrounding countries was very negative. So whether it's pharmaceutical companies being accused of falsifying data for some vaccines, or if it has to do with reports of a major adverse event to a vaccine, you know, it has a way of spreading, because now the world is such a small place thanks to, you know, the internet, and everyone is so connected. And our hypothesis, what we set out to you know, we were saying is there is in every community a baseline of people who just don't trust vaccines for various reasons. Either it's because they have experienced an adverse event, or they've seen someone who has experienced it, or they've read things about vaccines in the news, or seen videos that are against vaccines. So there's like a baseline level of vaccine hesitancy. However, what happens is when there is a vaccine-related event, so a vaccine-related event can occur if there's a major reaction to someone having a major reaction to a vaccine, or there's something important happening in the vaccine world. Let's say, like in the case of the dengue vaccine, where initially, it was rolled out, and as more research was being conducted, there was evidence that maybe people who had not previously been exposed to dengue virus might not want to take the vaccine because, of the potential effects it could have. Or, you have a change in maybe the way a particular vaccine is being labeled. So anything, important that happens in the vaccine world has the potential to further increase the amount of vaccine hesitancy within the population if it is not properly managed. And in the case of COVID, if, for example, the big social media outlets, so we're looking at maybe Twitter and Facebook, if they had not taken measures to ensure that people are directed to the right sources of information, to ensure that they are trying to actively pull out misinformation from the web so that people don't have access to some of these sources of information that are not credible, then there will be so much misinformation being fed into the populations about how COVID vaccines, for example, have the potential to alter your DNA, about how COVID vaccines have the potential to kill people. And people keep feeding into this misinformation. And this has the potential to increase the amount of vaccine hesitancy within the populations, leading to a potential outbreak. When we set out to model this phenomenon initially, we had thought we were going to use like a standard susceptible, kind of an SIR model where you have people within the population who are susceptible because then they don't really know what to believe. And then you have infected people who are usually like on the extreme, where you have people who are actively fighting against vaccines and who are not out to listen. And then you have people who are immune because, well, maybe they're like healthcare providers who are trained and who have the knowledge. But what we realized is, unlike, your typical infectious disease where you get infected and you get immune, information does not just go away like that. It stays in the mind. And it is passed on, like in the case of the African context, it's passed on actively from generation to generation. And now with the advent of the media, you would see that things that happened maybe 20, 30 years ago would pop up now and then in the media. So it stays there and it's active. So you constantly have to make efforts to try to, remove this misinformation from the media and prevents people from having access to it. Otherwise, they become further infected. So at the end, what we're advocating for is, whether it's baseline or it's reactive, the way you would handle each of these would be slightly different. Maybe for baseline hesitancy pre-COVID, people working in these areas would try to understand and maybe try to engage actively hesitant people in dialogue and trying to answer questions for people who have concerns. But if we had approached this more passive way of doing things with COVID vaccines, for example, it would have been a very wrong approach. So with COVID vaccines, with a lot happening, we needed a more aggressive approach to trying to keep misinformation out of the media, trying to feed people with the right information before they get fed with the wrong information. It's a lot harder when someone has already been fed with the wrong information and they believe it very strongly. It's a lot harder to try to, convince them to think otherwise. But for the people who are still susceptible, people who are still open to receiving the good information, people who really approach us with questions rather than trying to prove that science is all bad, we feel that there's still room for active transmission of the right information to ensure that these people are educated and that they take up the vaccines.
Thank you. Natalia, in Brazil, are we seeing a case of baseline hesitancy, or is it in reaction to events that are occurring specifically around COVID-19?
Well, Brazil has a very good history of vaccination programs. We have a public healthcare system, and we cater to 200 million people. So vaccination is free in Brazil for 200 million people, and we have always have a good acceptance of vaccines in Brazil. So it comes as a surprise to us, really, that now we're dealing with a growing vaccine hesitancy here. And although we had already seen a drop in our vaccination rates before the pandemic, we attribute that drop mostly to logistic problems, distribution, importation problems that we had, and not to anti-vax sentiment or anti-vax movement. That it was really never an organized movement in Brazil, such as it is in Europe or the US. So it was never a major concern to us scientists who work with vaccine or vaccine communication. Of course, we knew that it was there. Vaccine anti-vax movement was present in Brazil, but it was restricted to a very wealthy minority. So it was in our upper middle class, and very restricted. So it never really bothered us, and it really never affected vaccine coverage. But throughout the pandemic, numbers started to change, and it became really, really worrisome. We went from a population that was 97% acceptance of vaccines in a national poll published last year by my institute. So we published in April and last year, and 97% of the respondents said they were comfortable with vaccines, and they thought that vaccines were good, were healthy, and were good for you. And now, so we went from 3% of our population that were that mistrusted vaccines or that had some issues with vaccines, to 22% of our population in our latest poll that came out last week. So it's a really worrisome situation. And although I completely agree with my colleagues, I think it's been wonderful to hear you talk, but Brazil has a very particular situation in that misinformation now comes from the federal government themselves. So it comes right from the top and from the Ministry of Health. So when we talk about Facebook and Google algorithms that try to guide people, to send people to official websites, well, here in Brazil, people are forward to official websites. These are the Ministry of Health websites, where you can find really political propaganda about the use of chloroquine, for instance, and no real solid information about how vaccines are safe and effective. So it's up to us, scientists and science communicators here in Brazil, and to the traditional media, to make sure that solid scientific information gets to circulate and gets to people, and really and it's up to us to explain to people why we know that vaccines are safe and effective, how vaccines are made, and to deal with all these questions that will arise and that has been rising during the pandemic, because people all of a sudden, they have been exposed to vaccine trials and clinical trials and technical terms such as immunogenic and IgG antibodies. They had never heard of this before, and all of a sudden you have a whole population, and especially here in Brazil, people are following vaccine trials as if they were watching the World Football Cup, but they haven't been prepared to understand the content of what they're following. So they don't understand about efficacy and effectiveness and immunogenicity, and then sometimes traditional media in Brazil has usually been very helpful and very good, and they really welcome scientists. So we have a lot of space in traditional media here. I write a weekly column for one of Brazil's largest newspapers, so we have a lot of room to talk to the population. But even so, of course, part of the media is interested in clicks and baits, and sometimes you get a phase 2 study about a vaccine. And then you get headlines like, "Oh, vaccine X is super effective against COVID-19," and you say, "No, it haven't even been tested in phase 3 yet. So it's very difficult to convey this kind of concepts to the population. You really got to start from scratch, and you can't take knowledge for granted. You can't really assume that they know the most basic stuff, and you can't assume that their questions are ridiculous or shouldn't be taken into account. Nobody should know. Why should they know how an RNA vaccine works and why it won't mess with your DNA? It's up to us to explain. So I think we just have to learn how to communicate with the traditional media, with the public. And in my country nowadays, I think the biggest challenge is to do so while counteracting misinformation that comes directly from the federal government and from national institutions like the Ministry of Health. So I have to say to Brazilians that the Ministry of Health is wrong. And please trust scientists, talk to us, talk to the scientists, believe what you see in the traditional media. They're trying to do a good job, and they have been doing a good job. But it's a real challenge when you have to go against your government to be able to convey scientific information to the population.
Zai-Chen, in light of Natalia's comments, is on a global scale, is vaccine hesitancy in the COVID context as serious and as widespread as it appears to be, or are we dealing with, as Natalia said, the wealthy minority? Are we dealing with, in this case, the vocal minority? And are we focusing too much on the issue of mistrusts and anti-vaxxers at the expense of perhaps other more significant challenges in immunization programs?
Yeah, thanks, Fiona, and thanks for the comments, Natalia. I think there's a couple of things here. So one is that in the COVID-19 context, it feels like there's certainly a lot of newness, a lot of difference, but that there are a lot of the same kinds of things that we've experienced before. It might just be more rapid, more volatile, but as Alison said as well, some of the seeds were sown in previous experience. There are numbers of studies globally looking at things, and there are quite drastic changes that's happening up and down, and I think that also speaks to some of the vulnerabilities that, again, communities are experiencing. Whether or not we're focusing too much on this as an issue, I think it's really important to highlight just the point around kind of availability that you mentioned at the start as well, Fiona. We are still at a situation where there are significant hurdles in terms of global equitable access for countries, especially those in the global south. Significant hurdles for the COVAX facility in ensuring that, and even when they are available, the vaccines, the allocation will be limited. And so with that context, I think it's incredibly important to work to do all of the great work in terms of tackling misinformation. That's absolutely critical. To do work that builds trust and lays down strong foundations, but also to then really be engaging with people and with communities on how to get those limited availability of doses to the people who need it the most, how to prioritize effectively in ways that work for the local contexts, and how to really reach and distribute those. And I think that would be, those considerations are incredibly important. And they will, again, feed back into the longer term impact around trust going into the future for when the availability does increase. So I think, yes, it's incredibly important to focus on on trust and on tackling hesitancy as it exists. And it's important to do that in ways that also builds up the resilience of programs, builds up the capacity to deliver, and sustains that for the long term. We can't just be focusing on the immediate here because of the feedbacks that will take place.
Thanks. Alison, you touched a little bit earlier on the context in sub-Saharan Africa, but what are some of the concerns that have come up in the COVID context? As a member of Women in Global Health, can you see any interactions between gender and vaccine hesitancy or vaccine uptake? And we've also had a question come in from Judwin, who is Cameroonian, who's in the UK, says that vaccine hesitancy among Blacks is really high compared to other populations, I think, meaning in the UK. It says one of the reasons people give is that back in Cameroon, people are not affected. So why do they need the vaccine? And the question is, what can you tell such people?
So most of the causes of vaccine hesitancy, would fall under, well, people would classify it under each issues of confidence, issues of complacency, and issues of convenience. But what we're beginning to see with the COVID vaccines is that the biggest problems revolve around issues of confidence and issues of complacency, at least for the sub-Saharan African region. And it's difficult, I think, to put all countries within one box, because even within a country, the cause of hesitancy within a particular population would differ from another. For example, let me give you the case of Cameroon. I can talk a lot about Cameroon because it's one country where originally that's where I come from. And together with other colleagues who are currently in the platform, we've been doing some work as Women in Global Health within the country and as members of the Cameroon Town Hall to try to understand what's going on and to try to raise awareness and to try to engage our people actively. What we're beginning to see is within the Northwest regions and the Southwest regions, for example, in Cameroon right now, there's a civil strife that has been going on for the past almost 5 years. And it's political. And, it has to do with a minority feeling that their voices are not being heard within the country, they are being marginalized. And then they want us, there's a fraction that says, we want a cessation from the country. And as a result, there's been this infight between the government via the military and the people who are leading the struggle. And there's been a lot of accusations from the locals saying that the government has caused a lot of a lot of human rights abuses within the country. So these are accusations that are coming up actively. There are videos that are being circulated about the government burning down houses. So when you talk to the people who are found in these regions, the question they ask you is, if the government is ready to burn down our houses and kill our people, why would it bother them that we find ourselves infected with COVID? So if you go down with, say, a vaccine against COVID-19 into these populations, they would practically chase you out. They wouldn't even take it. They won't, not only would they say no, they would chase you out. So it has to do within these regions, for example, with a political issue, there's huge distrust for the government. But if you step out from the Northwest regions and the Southwest regions and you go maybe to the neighboring littoral or West regions, the causes of hesitancy would differ. People will be wondering, we've been seeing messages circulating in our WhatsApp groups around how there's a global agenda to have people have microchips. And we've heard about words such as Luciferus being used. And for us, we're a Christian country, and maybe people are attributing Luciferus to Lucifer, for example. And we sat in Cameroon and we heard French scientists, French professors talking about vaccines coming to be tested in Africa. And, there's this huge distrust for the West. The distrust comes as a result of, malpractices that have happened in the past and that continue to happen. A lot of countries within sub-Saharan Africa were colonized by countries in the West, either, for example, in the case of Cameroon, by the French and the British. And people locally feel like the French still have a strong hold in the country. So when you have French scientists sit and make statements that are derogatory, it comes down to the people, and the people say, oh, well, maybe there's even a lot more that happens underneath the mat that we do not see. So there's a huge distrust for the West, a huge distrust for the government because of things that have happened and that continue to happen. Now, with regards to complacency, many people within the continent feel that most African countries, maybe if you exclude countries like South Africa that have, evidently been hit really hard, a lot of other countries feel like, well, we are seeing an increasing number of COVID cases, but we've not been hit as hard as countries in Europe and the US. And people are wondering, why do you keep pushing this vaccine on us? Because we feel like we don't need it. It's not really, COVID-19 is not a problem for us. That's the feeling a lot of people echo in the field. And it's a challenge because we are concerned. The reason we are not seeing that many numbers, is it because we are not testing sufficiently? So it's a challenge because the government is trying to say, well, maybe we need to test a little more, but people say, well, based on the data that's out there, we feel like COVID-19 is not really a major problem for us. The role of women within the African context is powerful. Healthcare decisions in terms of actually implementing it are made a lot of times by women. It's true that as a result of the patriarchal system and because of the way the social constructs are made within the country, the men play a main role, but actually taking that child or taking, the person that needs to be vaccinated to the nearest local post will be done probably by a woman, because the men are more active, going out looking for income. The women are usually the ones following closely. When the child has a fever, it's the mother that's going to know. And it won't come as a surprise if women decide and say, well, we don't want these vaccines, nothing is going to happen. Vaccination is not going to happen. So women play an important role. And there's already data that's suggesting that women might actually be a lot more hesitant than men. Women might be questioning some of these vaccines than men, because not only are women the ones who actually actively make sure that children are vaccinated, they are the ones who circulate information among themselves. We women, we talk a lot more among ourselves in the African context than men do. So when there's something, the probability that I'm going to text my sister or my friend and say, hey, have you heard this, and circulate it, is higher. Blacks have had a lot of issues that have happened, unethical issues, unethical research, unethical practices that have happened in the past. Whether you go as far back as the Tuskegee trials, or even more recently around data that's been falsified by pharmaceutical companies, or trials that come to the African continent, or even within the more developed countries, but within Black communities, and people question how ethical some of the trials are implemented, how ethically some of the trials are implemented. And this constant existence of distrust is probably one of the reasons why a lot of people, whether it's Blacks living in the UK or in the US, or Africans themselves, have huge distrust for the vaccines. And many will tell you, well, I will take that vaccine after I have seen the first set of people take it, because I'm not a guinea pig. So let the others go take it, then I will take it.
Yeah. So we're just starting to run short on time, but I wanted to turn to some of the solutions and the projects that the three of you are working on. Alison, while we're with you, could you tell us a little bit about the project that you're spending your weekends on, reaching out to Cameroonians via social media?
Yes, sure. So I actually have on the, I see, looking at the list of attendees, we have some of our colleagues from the Cameroon Town Hall, Dr. Muno Kene, Dr. Judwinzo, Dr. Nicole Barga. We've been actively engaging healthcare providers of Cameroonian origin through the Cameroon Town Hall for Healthcare Providers, which is a platform that meets every fortnight for about 2 hours to 2 hours and a half to try to raise awareness around what's happening in COVID, and to try to understand the concerns that people have and to debunk the myths that are circulating circulating. It's unfortunate that social media has been our first stop, because that's where a lot of misinformation is actively circulating. And as you can see already, we are in different parts of the world. Judith, for example, is in the UK, I'm in the US, and we just thought to ourselves, no, we can't sit and not do anything. We need to actively try to engage our people. We've been using other platforms like, other Cameroon-based debate platforms. And it's interesting to see, I think we had initially underestimated the problem, to be frank with you. But once we sit on this platform and you get maybe over 8,000 views and you get the questions that are coming at you, that's when you realize, oh, there's so much in misinformation that's circulating. That's when you start to see the magnitude of the problem. And, it just shows us how much work we still have to do. The good thing about the Cameroon Town Hall, for example, is that many of our attendants are actually people at the Ministry of Health in Cameroon and at, decision-making level. So we raise these things so that they are aware of it. And when time comes for them to roll out the vaccination programs, they would, keep an eye on what they need to be doing to ensure that confidence is built and that the right information is circulating.
Thank you. And Zai-Chen, same question to you. Can you tell me about some of the projects at Wellcome that are underway to engage communities, particularly in the Global South?
Yeah, so we've started a couple of initiatives and supporting some work happening, and I'm also just looking to build up our work in this area as well. There's one project that we've been supporting in rural Mozambique, in Zambezia, working with Village Reach, who work on last mile of health service. And they've been taking this really interesting participatory approach, working with caregivers in the local communities as researchers to explore some of the barriers and drivers, the context around COVID, around an emergency situation, and to look at potential solutions that come from that community perspective, and really taking that community-centered approach to have the drivers and the context that are tailored to what's happening there. And with caregivers as the drivers of that research as well, really bringing in some of those perspectives around women, around family dynamics, as well as around the social groups that exist. And know that social norms and influences are such a huge driver and an important factor in confidence and in hesitance. More broadly, we're looking to build up work that really looks at activities that support resilient and responsive systems here, with communities at the heart of them. And so identifying what kind of works in those sort of contexts, and how do communities play a bigger role in leading that, in driving that, in owning that, and to be sensitive to the history and to the context, and then also drawing on the wider expertise that also exists not just within research and academia, but that exists within the communities as well. So how to bring those to the fore, and we're actively exploring projects and initiatives around that. We're also very interested in just the route to engagement. So we're supporting a project in Malawi as well, where it's looking at collectivism as an angle and as an opportunity into engaging around the issues around immunization. And again, that taps into social norms and social dynamics. So we're exploring how these different factors build on the worldviews and the cultural models that people have in order to look at what sort of engagement would be most applicable, most relevant, most contextualized, and also then how to communicate more effectively to the communities around them.
Thank you. And Natalia, you're involved in a really interesting new project called Team Halo. Could you just give us some background on the concept, how it was created, who's involved, and who you're actually attempting to communicate with? And you also mentioned before about sort of expressing that there's no such thing as a silly question. And I saw on the Team Halo Twitter page recently that there was someone was answering a question about whether there's a link between Bell's palsy and COVID vaccines. So what are some of the questions that you and the rest of the team are fielding?
Thank you, Fiona. So Team Halo is a United Nations initiative together with Gavi. So it's a worldwide initiative where they invited guides from all over the world. The guides are people who work with vaccine development or vaccine campaigns or vaccine communication. And these guides have to record videos on TikTok. It's a new platform, it's a very young platform, and a platform made for young people, so it was quite a challenge. I have to admit that the only reason I even knew what TikTok was is because I have an 11-year-old daughter and she uses that platform a lot, and actually she's the one who edits my videos. That's what makes them look good, because I would never be able to do that on my own. It's good to have an 11-year-old at home, but it's a platform that was made for young people to share music and dancing videos. And the problem is, and that's what I think that the United Nations really got a hit there, because the first time that they mentioned the project to me, the Team Halo project, they said, well, let me have a look. I didn't even know what TikTok was really about. The first search that I made on TikTok, I just searched vaccine, and like 30 anti-vax videos turned up, really. So it was an empty space. It was a space that we had to occupy as scientists and as science communicators. And this is something that I do with my institute here in Brazil. We always say that we have to make sure, our job is to make sure that good scientific information gets to circulate, so that when people Google it, when they Google vaccines, they are not directed to anti-vax sites. They are directed to the good sites, to our sites, to government sites where in those countries where government actually does a good job. So this is our job. We have to make sure that people get that people have access to the right information. And doing this on TikTok is both amazing and a challenge, of course, because we have to adapt our language and the way that we talk to very young people who are used to being entertained. And what we are doing on TikTok is not entertainment. We are giving information. But if we don't dress it a little bit as entertainment, people won't come, won't watch our videos. So we try to make it a light environment to talk about vaccines and to answer as many questions as we can from the from everyone. But we try to make it in a light environment without any moral judgment on what people are asking, and there are certainly no things as a silly question. So the questions that I get the most are, is it true that vaccines are going to mess with my DNA? Or is it true that there is a Bill Gates controlling chip that's going to be inserted with the vaccine? And of course, although we may laugh about it, but these are real questions people are asking, so they're entitled to an educated answer and to a polite answer. And I think this is why they stay. And it's amazing to see the results, because we do get a lot of questions. People want to know about herd immunity, and if I take the vaccine, will I be able to return to normal life just 10 days after? How is it going to work? Do I still have to wear a mask after I take my shot? Are you going to take one? Are you going to take a vaccine, a COVID-19 shot, and your family? And I think it's important that we answer, because the president himself says he's not going to take a COVID-19 shot. So Bolsonaro actually said it on national TV, I'm not going to take it. So it's very important that we give the example that the president is not willing to give. And we do have a lot of feedback. So it's amazing when you see you record a video. It's all 1 minute videos. So it's really difficult to really sum up all information in 1 minute. I recorded one video about RNA vaccines, explaining why RNA vaccines are not going to mess up with our DNA, and I had 80,000 views. So if 80,000 people saw that and now have a better understanding and are no longer afraid of RNA vaccines, this is what it is about. It's not about becoming a TikTok pop star. It's about getting information to circle around. So I think it's a great project. I'm honored to be part of it, and it's been fun. I think it's a light way to give information to the people, and it's a very interactive platform, because people can pose questions, and you can use their questions to record a new video. So it becomes very interactive, and they get used to you. They see that you reply, so they keep posting more questions. I think it's working really well. And of course, I'm a scientist, so I'd like to see a scientific paper about it, maybe in a year time, to see what the real results were and how maybe we can assess it. But from my anecdotal point of view, I think that it's working really well, and I'm really proud to be part of the team.
That was something I was curious about, as to whether you've got any way of measuring the impact of the project, or how you can sort of determine success.
Yeah, I don't know if the team leaders are working on that. I hope they are, because I think it's going to really give us actual feedback on what this kind on the reach that we can have on people. So of course, it's very difficult to measure people's attitudes, because people can like your video and can say, oh, you're great, I love you, and then they don't get a vaccine shot. So it's very difficult to actually measure behavior, but at least you can get a grasp of intention, and I think it's worth it.
Great, thank you. Unfortunately, we're just coming to the end of our hour, and we've got a few questions coming in that relate to a lot of what you were just saying, Natalia, about how can we address mistrust in media, and also in some of the pharmaceutical corporations. How can those working to reduce vaccine hesitancy convince the people that they're not in the payroll of these corporations? That's a question from Manuel. And we have another question: how important will leadership be for vaccine trust in sub-Saharan Africa? And another reflection on the need for leadership by example of public figures, themselves receiving vaccines. But unfortunately, we don't have time to answer these questions. So thank you very much to all of the panelists, and thank you to all of you in the audience for joining.